Hello, my name is Dr. Edmund Ediosage. I am a gynecologist and my specialist area is reproductive medicine and surgery. I'm here to talk to you today about endoscopic surgery. This is a real passion of mine and something that I'm bringing to women of Lagos and Nigeria. Endoscopic surgery is really beneficial to women of African descent because of our particular predisposition to form excessive scars and keloids, because it does leave women with much finer scars, in addition to some of the other advantages of endoscopic surgery, which include things like faster recovery from surgery, better access to deeper pelvic tissues, and less adhesions and less risk of complications. One of the great surgical revolutions of the last maybe 50 years is the introduction of endoscopic surgery, but it's only in recent years that we're beginning to see hospitals include endoscopic surgery within their surgical armamentarium. My purpose of talking to you today is to introduce endoscopic surgery and to encourage women in Lagos, in Nigeria, to think about seeing a specialist for endoscopic surgery if they feel that they might benefit from this. There are two main types of endoscopic surgery we offer. We offer surgery that we perform through the tummy, through the belly button, called laparoscopic surgery. And we also offer surgery that we perform through the neck of the womb, called hysteroscopic surgery. And there are various conditions that we use these surgeries to manage. If we take laparoscopic surgery, for instance, it's a very, very important way of managing women with endometriosis and pelvic pain. Endometriosis is one of those conditions that causes a lot of pain, a lot of poor quality of life, and causing fertility in women. And a really, really useful way of managing the condition is to do endoscopic surgery. Laparoscopic surgery gives us very good access to deep pelvic issues. It magnifies the endometriotic lesions within the pelvis, so we're able to see them more easily. We're able to remove them safely. And in the vast majority of cases, for the straightforward endoscopic laparoscopic surgeries we do for endometriosis, women are able to leave hospital on the same day and be back to work after only 2 weeks. This is compared to the traditional open surgery, where women spend at least 3-4 days in hospital and have to be off work for about 6 weeks, not earning any income. The other form of endoscopic surgery is hysteroscopic surgery. And hysteroscopic surgery is where we put in a telescope through the neck of the womb to look into the womb, and that way we can remove things like fibroids, we can remove things like polyps, we can remove things like adhesions within the lining of the womb. And all these are things that can impact very, very negatively on women's fertility. And for the first time, we're able to do these operations in a very, very minimal access way with very reduced risk of complications, and the vast majority of them can be done as day case procedures, so women only spend just that day in hospital. Now, there are many hospitals around the Lagos environment and across Nigeria now offering such surgeries, and my advice to women is women who suffer from conditions like endometriosis, fibroids, cysts in their ovaries, our women who need to have operations like hysterectomies should speak to their specialists about whether these conditions can be done for them by endoscopic surgery. And endoscopic surgery doesn't cost the bank, okay? There are many places now where such surgeries are very, very affordable. With laparoscopic surgery, you'll need to have a general anesthetic, meaning you need to be put to sleep. And you'll have a cut made through your belly button where a telescope will be put in to have a look inside your tummy and your pelvis. And for the vast majority of operative laparoscopic operations, you have maybe 2 or 3 other small cuts in the tummy where other instruments will be put in to have a look and to deal with whatever condition it is that needs to be dealt with. The vast majority of such operations will probably take 1 or 2 hours, and the vast majority of women will be able to go home following those procedures. Thank you for listening to me, and once again, I'm Dr. Ediosage, a specialist in reproductive medicine and surgery.